So in our previous lecture, we spoke regarding surfactants. We have spoke regarding surfactants, their types, and even we discussed regarding HLB scale. Now we know that from the HLB scale, we can understand that there are different applications and roles which are being played by surface active agent. Like we have seen the classification of surfactants based on their HLB value, like antifoaming agents, solubilizing agent, detergents, W by O emulsions, O by W emulsifying agents, wetting agent. So these are the different applications which are being played by surfactants. In this particular lecture, we are going to talk about two important applications of surface active agent, that is solubilization and detergency. It helps in number of applications, but these are the two important roles which are being played by surface active agent. As we have discussed earlier, surfactants are also known as amphiphils, and they are known as amphiphils because they have both polar as well as non-polar properties in the same molecule. So what happens when material is lipophilic in nature? It is oriented inside the micelle, and when it is hydrophilic in nature, it is being oriented on the surface, because you have non-polar head and polar tail. So polar tail will take care of the polar material, and non-polar heads will take care of lipophilic molecules. So it helps in solubilizing the material, whether it is hydrophilic or lipophilic in nature. It will be taken care of by surfactants. And in surfactant, the surfactants above the concentration of CMC, it helps in solubilizing various poorly soluble materials because of the micelle formation. So this we will be discussing, and then we'll be talking about detergency. In detergency, we are actually interested to remove the dirt and oil or greasy material from the surface. Now, when we try to remove it with the help of water, it doesn't happen. It is just because of the contact angle which water forms with the surface of the oil or grease. With the help of surface active agent, actually it reduces the contact angle between the oil material or molecules of grease and water molecule which is being used for the cleaning purpose. So there also the interface is being involved, and that interfacial tension is being reduced with the help of surface active agents. So these are the two important applications which we are going to discuss today. So as we have discussed previously, that surfactants are being called with different names like surface active agents, amphiphils, your tensides. So different names are there because it has so many roles to play. The use of surfactant are not only as emulsifying agent, detergents, wetting agents, and solubilizing agent, but they also find application as antibacterial and other protective agents, and as aids to the absorption of drugs in the body. Because you can understand how they are playing these roles is by working at the interfaces. When we are willing to kill bacteria, or say when we are interested in increasing the absorption of the drug across biological membrane, in both the cases, the interface is involved, and the antibacterial agent may not work properly onto bacteria unless and until there is an interaction properly taking place between that antibacterial agent with the microorganism. Similarly, we have seen that absorption of the drug across biological membrane will be only possible when the molecules of the drug are in proper form, lipophilic, as we have discussed, to permeate across biological membrane. So if there is interfacial tension existing between these two, that can be reduced by surface active agent. Even they themselves, they can act as an antibacterial and protective agent and can be used along with the dosage form or drug to increase the absorption. Surfactant may affect the activity of drug or may itself even exert drug action. We have example in case of penetration of hexyl resorcinol into the pinworm. This increase into the concentration of this particular material in pinworm ascaris, it is being increased by the presence of low concentration of surfactant. And this potentiation of activity is due to the reduction into the interfacial tension that exists between liquid phase and cell wall of the microorganism. So, as I said earlier, surfactant, because they reduces the surface and interfacial tension, they are going to increase the mingling of two phases. The way we require common frame to reduce the tension between two different parties. So similarly, surfactant act like that party which tries to bring two phases intermingling together without any tension. So that interfacial tension that exists between those two phases, here example of hexyl resorcinol is being given, which is being used as anthelmintic for treatment of pinworm. So you can increase the concentration of anthelmintic into those microorganisms, and when it will be possible, when surface active agent, it reduces the interfacial tension between liquid phase and cell wall, so that the drug will permeate across the cell wall of the microorganism and will be able to kill them. Even quaternary ammonium compounds, these are the examples of surface active agents that in themselves they possesses antibacterial activity. Quaternary ammonium compounds, there are various examples of quaternary ammonium compounds which are antibacterial agents. They are used in various dosage forms. Even non-ionic surfactant are least effective as antibacterial agent. Non-ionic surfactants, being they are non-toxic and harmless, they do not act as antibacterial agent. Quaternary ammonium compounds are the surfactant which acts as antibacterial agents. So in the previous slide, we discussed another applications of surfactant apart from the common applications like emulsifying agent or your detergent or your anti-foaming agent, or say your anti-foaming agent or emulsifying agent. We are going to talk about two important things, that is solubilization and detergency. So let us talk first about solubilization. When present in a liquid medium at low concentration, we have discussed this, that amphiphils, when they are present at a lower concentration, they remain as monomers or individuals. But when we go on increasing the concentration, slowly aggregation of the monomers starts taking place over a narrow concentration range. The concentration of monomers at which micelle formation takes place, that is being known as CMC, and the number of monomers that aggregate to form the micelle is known as aggregation number of the micelle. For every surfactant, this number of micelle, aggregation number of micelle is different and it is unique for that particular surfactant. Few surfactants are there where even less than 50 monomers come together and forms the micelles. There are some surfactants where more than 50 monomers needs to come together or agglomerate or aggregate to form micelle. So, as I said earlier, that when we are dealing with amplifiers or surfactant about their CMC, then the size of the micelle, when micelle will be formed, the size of it goes into the colloidal range. Below the concentration of micelles, the material lies into subcolloidal size range. So it is an important property of association colloids in solution to increase the solubility of the material that are normally insoluble or only slightly soluble in the dispersion medium used. And this particular phenomenon, which is possible because of the micelle, is known as micellar solubilization. So as such, surfactant may not increase the solubility of a given drug or given drug material unless and until concentration of surfactant is increased up to CMC. Above CMC, you will find that being micelles are being formed, micelle is a compact structure where all non-polar heads will orient inside, leaving their polar tails outside. So this kind of picture I have put up in our previous YouTube video, the title slide, where I have shown that monomers are coming closer, aggregating and forming the micelle. When these kind of micelles are formed, water is used as a solvent. When water is being used as a solvent, all non-polar heads will go inside, forming a lipophilic core, and polar tails will be orienting outside. These polar tails of surfactant will remain associated with the water molecule. So what happens when we are having solubility problem with any particular drug or a molecule? It is being dissolved into the surfactant solution, which is being maintained above its CMC. So when that material or that drug molecule will be added, it will orient itself either into the core, which is lipophilic in nature, or will orient themselves onto the outer side of the micelle, which is hydrophilic in nature. So depending upon the nature of the material, orientation of that material will take place either into the core of the micelle or onto the exterior of the micelle, and solubilization of that material will take place. And this particular phenomenon is known as solubilization or micellar solubilization, to be accurate. The location of the molecule undergoing solubilization in the micelle, it is related to the balance between the polar and non-polar properties of the molecule. If it is polar in nature, it will remain associated with the polar tails. If it is non-polar in nature or it is lipophilic in nature, it will go into the core of the micelle and will get dissolved into it. Lawrence was the gentleman who was the first to distinguish between the various sites. He proposed that non-polar molecules in aqueous system of ionic surfactant would be located in the hydrocarbon core of the micelle, where all your non-polar heads have come together and form a lipophilic core. So non-polar molecule will go and will get dissolved into the hydrocarbon core of the micelle, whereas if polar material is there, it will solubilize onto the micellar surface or exterior polar tails. So polar non-polar molecules would tend to align themselves in an intermediate position within the surfactant molecules, which has formed the micelle. Non-ionic surfactants are the most commonly used pharmaceutical excipient as solubilizing agent because of their lower toxicity. And the common examples of non-ionic surfactants which are used into pharmaceutical industries are sorbitan esters, or we call them as SPAN. There are different grades of SPAN which are available: SPAN 20, SPAN 40, SPAN 60, and SPAN 80. Whereas twins, that is polyoxyethylene esters, sorbitan esters, these are hydrophilic version of SPANs. So what happens with the twins? SPANs are lipophilic in nature, and that's why when polyoxyethylene chains are being added into their structure, the material or the molecule becomes hydrophilic in nature. SPANs are lipophilic in nature, but because of the insertion of polyoxyethylene chains, they gets converted into polyoxyethylene sorbitan esters, making the material perfectly hydrophilic in nature. So SPANs are lipophilic and twins are hydrophilic, examples of the non-ionic surfactants which are commonly used into pharmaceutical industries. The pharmacist must give due attention to several other factors while formulating the solubilized system successfully. It is essential that the concentration which is being employed of surfactant, which is going to be taken internally, it needs to be non-toxic. It must be miscible with the vehicle or the solvent which is going to be used during the formulation of the dosage form. At the same time, it must be compatible with the material which is going to be solubilized or the drug molecule for which we are going to use these Micells. It must be free from disagreeable odor and taste, and it must be relatively non-volatile, because it should not happen during formulation. It is giving you a proper solubilization, but over a period of time, your surfactant, if it is volatile in nature, it will evaporate, again leading to precipitation of your drug molecule into the formulation. So as we have used surfactant to increase the solubility, it is going to be consumed along with your dosage form or along with your drug, and that's why it needs to be non-toxic. It has to be compatible with the drug molecule. It should not alter the properties of the drug molecule. It should be free from disagreeable odor and taste. Otherwise, patient will not be interested in consuming that formulation if it is not having agreeable odor and taste. And the surfactant which we have used must be non-volatile. The amount of surfactant which is used will again play an important role. A large excess is undesirable from the point of view of both possible toxicity and reduced absorption and activity. Even insufficient amount can lead to precipitation of solubilized material. So optimum concentration of surfactant must be used as a solubilizing agent to ensure that solubilization of your drug molecule takes place properly. So no extra amount of surfactant has to be there. So excess surfactant, if it is used, it can lead to toxicity, or even it will reduce the absorption and activity of your active ingredient. And insufficient amount, it can lead to the precipitation of the solubilized material. So optimum concentration, so it will be trial and error kind of thing which you will have to carry out to understand how much amount of surfactant you will have to use for solubilizing the given material. The amount of material that can be solubilized by a given amount of surfactant, it is a function of polar and non-polar characteristics of the surfactant and of the molecule which are being solubilized. So which material you want to solubilize, based on that, the selection of your surfactant will be done as a solubilizing agent. Mostly the surfactants having HLV value above 13, they are used as a solubilizing agent. So in your HLV scale also, you must have seen 13 above, 13 to 16 it is being given. but the scale range goes up to 40 as well. The HLB of anionic surfactant, that is sodium lauryl sulfate, is 40, and that's why it is being said that it is an arbitrary scale. Fixed नहीं है वो कि 0 to 18 है scale. You have surfactant like sodium lauryl sulfate whose HLB value is 40. So which surfactant we are going to use as a solubilizing agent? It depends upon the material which we want to solubilize. Mostly the surfactants having HLB value above 13 are commonly used as solubilizing agents. Is that clear?